So good afternoon, everybody. Welcome to our monthly regional abatement call. Happy to have everybody on, and again, joined by a number of folks from OASAS in order to be able to answer questions you might have. We do have staff from the Division of Fiscal Administration. We, of course, have our Opioid Settlement Fund project management team on as well. So for today, we do want to just walk through some and give some updates. Lucia, can you open the PowerPoint, or are you relying on me for that one?
Either, we can do either.
If you could open it, that would be great.
Okay.
So there are, a few updates, and certainly there's talk of money, right, that we need to have. So if you can put that in presentation mode, that would be great, Lou. And in terms of the reporting overview, so let's jump in there. We did ask that the LGUs and the other litigating entities who received dollars from the state fiscal year 2023 appropriation to please submit your report. So if you could go on to the next slide, to please submit your report on use of funds by August 1st with some wiggle room, right? I mean, we understood that folks were, it was a tight turnaround for that report. So very happy to say that we did receive 62 of the 79 reports that we were waiting for, which is great. If you are one of the 15 who hasn't submitted your report yet, know that the Opioid Settlement Fund project management van is going to be driving around the state, knocking on your door, asking you to please provide your report. So do know that we will be reaching out. We do need that information from all of you because, again, I want to remind folks that OASAS is responsible for reporting out on the use of these dollars, on the use of opioid settlement funding. And there is a report due November 1st that we will use this information to speak to how the regional abatement has gone. So if you haven't gotten it in, please, please, please do. If we could go back to the last slide, I'd appreciate it. Not ready to go on yet. Another good point. So, and I understand that the zeros have been employed frequently on the reporting, which we absolutely anticipated would be the case, right? This was just to get the report in. It was in a way a check the box exercise, but and understood that not a lot may have happened yet for you to report out on. So thank you for going through the exercise with us. We understand there would be a lot of zeros. For those who may not have submitted because maybe you're hesitant about putting those zeros in, don't be, right? We've been really clear in our conversations that it's expected. You may not have a lot of data to report just yet. If you have any questions or concerns, always the Opioid Settlement Fund project management mailbox, and the address is there for folks to reach out if you have any questions or concerns. Next slide. So in terms of timelines, I just wanted to remind everybody, and I will continue to check in with folks, with regard to the timeline we have identified for reporting out. And part of the beauty of this timeline is one that we can stick to for the next 16 years. And this is how we'll manage our reporting going forward, right? So we, as I said, have our report that is due November 1st of every year. In order to meet expectations for the 2023 report, we ask that you submit your information as best you could to date by August 1st, and we'll use that information for this year's report. We ask that you talk about spending through June 30th. Now, what we're doing in 2024 is we're actually pushing ourselves so that we're following a calendar year for reporting, just to make things easier, and to keep things more in keeping with what is your state fiscal year, which is the calendar year. So we are going to send out a link on March 1st, 2024. I'm going to challenge the project management team to actually send the link on March 1st, 2024, right? We've got 5 months to make sure that we have everything ready to go out on March 1st. You'll receive that link, and we are going to ask you to then submit a report that will cover your spending for 2023. So it's going to include anything you've done during calendar year 2023. We are going to use that information to inform the November 2024 report that's due. And two, we're going to give you a month to complete that report. So we're giving you lots of heads up that this is coming, that this is our cycle, this is our expectation. You'll have a month to complete the report. The reporting format will not change dramatically. I don't want to guarantee there won't be a little tweak here or there, but it won't change dramatically. And that report will be due the 31st. The 31st of March, and it'll reflect your 2023 spending. Okay, so we're clear on that, and I don't know. I want to let's put something on that, right? Like Debbie Davis takes project management out to dinner if we make sure we get the link posted on March 1st. Woo! All right. Next slide, please. Okay, so a couple of reminders. The project management team, the evaluation team are going to be holding small focus groups this fall. Lucia, do you want to talk a little bit about that?
Sure. I think, Ashley is eager a little bit we want to hear from you. What we have heard from you so far is pretty amazing, right? Like how some of you have planned and used already existing structures in place to make these plans and to carefully think out how you want to do the spending and ask the questions. So we're interested in knowing that for a couple of reasons. We can highlight some of those things in terms of process for the reports that Connie's talking about, because I think it's important for OSFAB to hear from you about your process, your thoughtful process, and how you're putting the dollars to work. The other thing is we kind of want to get a sense of, as Andrew likes to say, right? If you know one LGU, you know one LGU. But we want to see if that is really the case, or are a lot of you going through some pretty similar planning processes and taking a similar approach in how you're spending the money. These require absolutely no pre-planning from you. We are not asking you to show up with information or data or anything like that. It's really more of just a conversation, but we want to do it in a thoughtful way. So we'll plan the questions and we'll make sure we're hitting each group with the same exact set of questions and doing our work carefully. And that could inform, as Connie said, those minor changes to the reporting in March. Like we might want to ask you a little bit about telling us how the plan's going, if you plan to use the same approach every year as you have these dollars to spend. So look for that coming up. We're saying fall because fall is three months long. So when we have something more accurate than an entire season to say, you will be hearing from us.
Great, thanks, Lou. The other thing that we wanted to talk about is the 2024 dollars that have not been made available yet. So another reason to complete your August reporting for 2023 is that is going to be the marker for you then being eligible to receive 2024 dollars. So know that we do need to get reporting from everyone receiving dollars, and we are in a position where we need to get the reporting, and if we don't, we may withhold payment for subsequent years until we get you in sync with us in providing the information. So, so knowing you submitted the August report, thank you very much. We are working with DOB to receive the final calculations for the dollars that are available through regional abatement. Once we have confirmation of those dollars, we are going to apply the same formula that we used for 2023 to determine the amounts that are available to each county. And we're going to make that information known to you through the same process that we went through in 2023. And that is, we will send you essentially an award letter saying how much you have coming for 2024 appropriations. Again, as we've done before, counties are acting as the pass-through for the dollars that are going to the other litigating entities. So that award letter will also include the amount of money that that will pass through you onto the cities, small cities, villages, and so on, who may be receiving dollars. So I don't think right now we have a target date for issuing those award letters. I know that Debbie Davis is working very closely with DOB and pushing to get that information as soon as possible. Debbie, you want to weigh in?
Yeah, I just want to share, there's just been, another agreement that is being deposited, and, they're just working, DOB and the AG are working together to make sure the formula is accurate and how that gets applied. So we just don't have the final numbers yet, and we don't exactly have the date, but they're all working on it, and we know it'll be available, as soon as possible.
Yeah. So, and then you'll have more dollars to figure out what you're gonna do with them, right? So, so more will be coming on the 2024 appropriations. And again, I appreciate our trying to work through and establish a process that we will have in place for a number of years to come. The other important reminder, so OASAS did make available the local impact initiative opportunity, I think a couple of weeks ago. And with this effort, our intention was to make dollars available and reach folks who are not currently part of the OASAS provider system. And so we were thinking of small community-based organizations that may be providing harm reduction services. And this would be an opportunity for us to be able to get dollars to them. And it's not just those doing, say, harm reduction. There could potentially be other types of community-based organizations who are making an effort in addressing the opioid epidemic. Let's say, you have an entity that, is interested in distributing naloxone kits or providing some other type of harm reduction support. If it speaks to the opioid epidemic and the service falls within one of those 10 priority areas as outlined by the board, there is funding available to support that organization. So the application due date is October 31st. We intentionally left this open for quite a while because we'd like to give folks a chance to apply. It is one award per organization. It is first come, first served. But I really see that we have the capacity to issue quite a few awards. The challenge we're having right now is that we're trying to reach providers who are not part of our system. So an all provider send isn't really going to get to the folks that we're trying to bring into this opportunity. I know we did share the information with you as LGUs and ask that you distribute the information and make it known to those smaller CBOs in your county that would be eligible and hopefully interested in receiving funding. And that's a question I have. So for the folks who are on, did you share that information, or even on your social media, or by way of an email list that you might have. And certainly if you have other suggestions to us as a state agency as to how we can get the word out, I'd be interested in hearing them. And please be aware too that the application is as straightforward as we could make it. I would love to say it's a strictly one-page report. Know that the application process has necessary language, right? Because the state's still providing dollars. So there are certain thresholds that we had to meet in terms of what was included in the application. So if I could ask, and happy to have people unmute themselves, have you talked about the local impact initiative, and do you know of any providers within your county who are interested in applying?
Hi, Connie. It's Suzanne.
Hello.
How are you? Happy
Good.
Friday.
Yay.
So I did push this out to some of our local rescue squads, a youth center, one of our transitional housing programs. What's really kind of difficult to work with is that 300,000 framework for funding, right? That's their net budget. So that's a little problematic because that really is a very small amount. But I did push that out to three agencies in the county, and working to push it out to others as well.
So if I could, that's helpful feedback, Suzanne, very helpful. And so that was a decision point that we discussed in terms of how do we best reach the group that we wanted to with these funds. And so from your perspective, hearing that, and hearing you say that 300 is a relatively small amount, what amount would be the right amount? How would you define or describe that population?
So, let's, for example, the rescue squads, right? So we have small rescue squads, one of which, does come under that cap of, 300,000. They're a volunteer. But then when you get to a larger area, like for example, Franklin County, Malone, it exceeds that, right? So I don't know what the best number is to use, but maybe increasing it to 500,000 would give us a little bit more flexibility.
Mm-hmm. Okay, that's helpful feedback. Thank you. Thank you very much for that. Others? Feedback or comments on the local, I already forgot, Lucia, the right language, but
impact initiative.
Local impact initiative, thank you.
Yeah.
We shared it here in Rockland County. I haven't heard of anybody say what, if they were going to apply, but I agree with Suzanne that, $300,000 is a low number. Especially, the more downstate you get, things are way more expensive down here. So I think increasing it might be helpful.
Okay, thanks, Janet.
And I appreciate the feedback also, as Connie has shared. I guess my question is, we were hoping to get to those providers that really struggle to make any revenue. And maybe that was the wrong intent, you know what I mean? But it was really about kind of listening to the communities that have presented at the meetings and really wanting to give community providers who are just sort of maybe traditionally not, even though they're 501c3s, they may not, have opportunities to pull down money. And so that's what we were thinking. But, if I'm understanding your feedback, you're just saying that perhaps you don't have sort of a group of those in your communities that you're aware of that would be at that level, that even that description would be just more revenue that they bring in.
Yeah, I think it comes down to the intent, right? So we want them to contribute to, resolving the epidemic. And I'm just thinking like 300,000 in terms of expenses, in terms of, staffing. That's really small for some of our agencies. Like what types of agencies were you thinking?
The 300,000 number is about revenue that they bring in,
Revenue.
not their operating budget. So they could have like $1 million. I mean, it just depends, and they, bring in $300,000 of revenue, but maybe,
Revenue, yeah.
So I think, this Sharon and Cortland, Suzanne's point is really well taken. We've had a lot of folks not understanding. That's not defined, I think, well enough that you're talking about 3 million revenue. It's such a key point, and I think a lot of people are passing it over, not understanding that descriptor.
Yeah.
So thank you. This is why I appreciate you all. This is why we need to work together. Okay, so that's really important. And then, so along those lines, and so in order to better communicate, so we need to think about how to better communicate that. But then also in terms of making the information available, are there any thoughts that folks have in terms of making that information available outside of obviously posting to our webpage and sharing information with you to then share with others and help make them aware? I'm wondering if even like a one-page summary of what we're trying to accomplish here in the high points in terms of, the revenue piece. And if we provided that with you, would that be something that you could then distribute to the folks within your community and share it and let them know, we're very interested in supporting them and making, funds available? And could we encourage them to apply?
Yeah, I think that would be helpful. Like a one page, just where you can see it all a little colorful, where people can kind of read it rather than have to read the whole
Right.
thing. That might be helpful. And if I could just clarify, Debbie, are you saying 300,000 net revenue, like after revenue and expenses?
Mhm.
Or are you talking about 300,000 just revenue?
I couldn't get to my unmute. It said total revenue, so I went to the website just to check sort of what we had written in the description. And find it. It says,
Less than
let's
300,000.
see. Through the opioid settlements, 1.3 million for small local community organizations to fund 9,500 each in those priority areas. Then it talks about eligibility, have a validated current total revenue of less than 300,000. So, and then, that's just the description, making it kind of easy one pager to look at on our website. And I think that it might have gone in the announcement, I'm not sure. And then when you click in, it gives a little more information about that.
Mhm.
But yeah, it was total revenue.
Yeah, so, and Debbie can correct me if I'm wrong, but we're not trying to exclude those groups who have a big reach and who maybe have a lot of money flowing through their organization, but it mostly flows right back out, right? That's kind of who we were looking at, because you could have an almost all volunteer organization with $1 million coming through their accounts and $1 million going right back out, right? So that would be a group that would be eligible because they're not having revenue. Right, Debbie?
Mm-hmm. Yeah.
Okay, so you're talking net revenue after expenses. That's right. I wouldn't have read it that way.
No way.
Not in the,
so again, helpful feedback, right? So we can clarify that. We can say net revenue, I believe, Debbie, you and I we can circle back
Well,
on
I know.
that.
Yeah. Well, we are actually going to there's a couple of questions that we've gotten to that, although it states it in the procurement, we felt that since people are asking a question, that maybe we need to make it bolder and describe it more. So this might be something we need to make bolder and describe more, and then we re-release it. So we appreciate this feedback for sure.
Yeah, great. So there's a question in the chat. Could you define revenue? Do donations count as revenue? I'm not an accountant or a tax person, so I don't know how to answer that question.
Yes.
So are you agreeing, yes, I'm not an accountant or a tax person?
No, I
Donations
agree that
don't
it's revenue coming in, people can bequeath, what is it? You can have a foundation of money that give you money. You can have federal grants. You can have taxes. You can have fees. All of that is revenue.
Okay. All right. I just learned something. All right. Great.
Amy's on. She's and Tara. Do you have anything to share on that? Or any other thoughts?
Donations, contributions, wherever they come from, if they're coming into a program, are considered revenue. It would be the same definition as we operate with the CFR.
Mhm.
So donations would be considered revenue.
Yeah, and we did go back and forth. This is why I will share. We went back and forth on using net revenue or total revenue. So although I know that people are saying it's not, in the application itself, we landed on total. I'm going to tell you that's what it says. It doesn't say net.
Yeah.
So if that, so that is where we landed. But I will look at how we described it and get back to you, because I know that we went around and around about it.
Mm-hmm. I mean, and bottom line is we want to make these dollars available, right? And
yeah.
so,
Oh, yeah.
It's challenging to craft an application and parameters when we've never done this before. And two, we don't know the group, we don't know these entities, right? So we're kind of like spitballing here in terms of like, what are the right parameters and how do we do this? And so, know that, we need the feedback. We want to hear the feedback. We need to revisit this so that we can ensure that people are understanding the opportunity and taking advantage of the opportunity. So, so this is really helpful.
So Connie, could you identify like types of organizations that you're thinking about, so that maybe we can focus in on those that we have not thought of? Just some examples.
Oh, go ahead, Lou.
Who you're looking for?
So Suzanne, I think so Debbie heard this term somewhere. I think it was from one of the OSFAP meetings, is like a treatment adjacent organization. Somebody who is, we could have an organization that all they do is provide transportation to a treatment provider. So, but again, don't like get locked into this idea. Well, you said transportation, just what some group who is serving the SUD community, but it does not have to be an SUD service.
Correct.
Right.
Even like a community coalition, right? You might have a small unfunded coalition who would benefit from some dollars to help support, even messaging around, something around opioid crisis or using opioids.
We also know that perhaps there are recovery programs that are operated by, churches or other not-for-profits that don't get funding from us that might benefit from it. We're only aware of the recovery programs that we fund since they're not a certified service, but there might be others out there like that or other similar like youth programs or some of those kinds of
Did
things
that.
that don't come up on our radar because they're not a certified service, but we're aware of those being out there.
Yeah, I just saw
Mhm.
a small provider, but again, due to the definitions that we put forth, may not have exactly been eligible. But this organization's whole mission was to board and take care of your animal while you're at treatment, right? Like that's, they are facilitating someone moving, you know,
Into
towards,
recovery. Yeah.
yeah, some type of assistance, but they themselves don't provide that assistance. They provide something else.
So I'm curious, and maybe others have a good answer to this. Organizations that small aren't on the radar at all from a standpoint of us knowing their fiscal budgets, et cetera. So how are we going to be able to define that going, well, they look like they operate less than $300,000?
So Brian, I mean, what I think would be great, I mean, so to the extent that you guys have a communication mechanism that you could use to make the information available, and then I think that these entities have to kind of self-identify and decide to apply. And so, you know, I'm thinking even if you all have a county social media page where you could post information, or you could post that this opportunity is available, and then entities can see it and say, oh, well, I'll take a shot at applying for the funding. If you do have a mailing list that you maintain, and two, the thing is that hopefully some word of mouth will assist us here as well. So as you communicate this to the entities that you're aware of, maybe they know of an entity that's not part of your communication network, but they work with or they refer to, or, you know, they try to help out every once in a while. They could say, hey, OASAS is providing this opportunity. You know, I think that, you know, may be a way to get the word out as well. You know, we're looking at how we can use our social media capability to just put it out there and just like make it known for anyone who would be seeing our Instagram or our Facebook page or whatever. It's tough, right? Because we're talking about entities that none of us may normally be in touch with or have part of our network. If you have a newsletter, a county community newsletter, and, you know, I'm even thinking of, you know, some of the newsletters that might go out from a trade association, they may be read by, and people may use it as a source of information, even though they're not part of that association, or they're not identified as being like a certain type of provider, but they may look at that as an information resource. So even posting it there would be an option.
Would there be any issue with us taking this language that you have on the website and giving it to our local paper so that they could put it in the paper? Would there be any hesitancy there on your end if we did that?
I'm looking at Debbie Davis, and I think that, I don't know from a fiscal perspective and from counsel's office perspective if they would have any issue with that. I mean, it's public information.
It's public
Right.
information, which means as long as it's being reproduced exactly as it is on the website,
Right.
shouldn't be a problem. It's already public. It's out there.
Yeah.
Right.
That's cool too. A question, let's see, a couple of questions in the chat. Let's see, George was asked if the funding provided would be continuous and for how long. So with regard to the local impact initiative opportunity, this is one-time funding in terms of this opportunity. I think that part of what we're trying to accomplish as well is identifying and expanding our network, and again, dollars will be available for a number of years, and to the extent that we are able to support these non-traditional OASAS, you know, providers, we certainly will continue to look for opportunities to do that.
Yeah,
but
I just want to throw in too, you know, some of the initiatives that we were able to do, which really address the epidemic, and there were larger dollars put behind it, come with the responsibility on the provider's part to follow a lot of state rules, such as being in Grants Gateway, Charities Bureau, and having those documents that you provide in those systems updated on a regular basis. And so, not all, entities, organizations, that's part of the reason why we don't know who they are. Not all of them are in our systems and have the capacity to be in our system. So this was just a way to really recognize that there's some, good work being done out there. And like Connie said, coalitions or just, church groups or things that are happening out there that really do affect and provide services, and that could really use this, impact grant to help them continue that mission. And so that's really what we were trying to accomplish, was to give them the ability to do it without having to jump through a lot of state hoops.
Mhm.
There's also a question in the chat. So an agency essentially that is providing services to meet social determinants of health, would they be eligible for this opportunity? So
I think they need to follow the application.
Yeah.
That would be, the application says, sort of what your scope of work needs to be focused on.
Yeah.
But I don't know.
Again, the application isn't, I think, overly rigorous, overly taxing. And so I would encourage, folks to apply, right? What's the worst thing that can happen? OASAS says, no, you're not eligible. Okay, so then any other comments on that?
Yeah, this is George Rothes from Yates County. We did get out to a lot of entities, and I put a couple of questions in there because number one, one-time funding is not necessarily what works in the long run, because anything you initiate, if it's one-time funding, then you're stuck with, does it then end, or are you then stuck with having to raise other funding? And it limits exactly what you can do, because you really have a time limited window to spend money, which can be a pleasure, I guess, on one end, but a weight on the other, given that whatever you initiate, then you really have the obligation to continue, but you might not have the money to continue. So, I mean, that's some of what the feedback I got. I went to a number of social agencies that do a variety of things that support people in general, including people who, in fact, have been impacted because of opiate or other substance abuse. And so they were logical to go to, but the concern in each case with agencies that are very, shall I say, poor, not in any state funding or anything else, it's a real challenge for them to take a risk to start something new, even if they really can get behind it. So we're still encouraging that, and we're looking for other ways to reach out. The idea of putting something out in the newspaper, in some counties we have limited public information that goes out, but we're going to hit the things that exist, and encourage other people to at least call and ask about applying, rather than just ignore it. So we're working on it. I think it's a unique idea to get other parties involved, and to really, in one sense, get more of the community involved. And so we're certainly going to do our best here.
Great. I appreciate that, George, very much. And we very much recognize, right, this is a one-time, amount of funding. It's meant to kind of address a small need. It's not continuous, it's not ongoing. Two, I think I know we're very challenged in terms of how making dollars available, right? I mean, we have procurement processes and rules around contracting and all of that. So, we wanted to find a way of making some money available and as easy a way as possible, and reaching those entities. And so this is just a first effort. And like I said, we really are wanting to be able to, know who these entities are and so that we can continue thinking through and how we can, better reach them, how to better fund them, is it a matter of bringing them into our fold or whatnot. So this is just the beginning. This is a first effort. And then in terms of, other things to talk about. So, and thank you for that discussion. We do have information. I think that we've shared this in the last meeting. So we do have, information in terms of how the regional abatement dollars were proposed to be used. And if you go to our Opioid Settlement Fund page, we have some graphics with regard to the regional abatement. And Lucia, you want to show what you have on the next slide? So a reminder to folks that we do have this bar graph to show of the proposed use of dollars that you all reported out on for the entire state. This is how we're talking about using those regional abatement dollars. And in addition to that, we do have information at, I think it's the county level. Thanks, Lucia. So we also have so this is just a different way of depicting that information. Do you have the slide in terms of the county amounts? Because I'll just share my screen. So I'll go ahead and share. So for folks to be aware of the fact that we do have the information also available by region. And so anyone can go to the website to see how much each county has available to them. And then on a regional basis, looking at, so for the funding that went to the capital region, this is how the dollars were proposed, just to break it out a little bit. We also do have links to the LGU's webpage. So know that if someone were to see Albany County, 1.5 million, you can also go to the Albany County webpage if you're looking for additional information or you want contact information to be able to reach out and talk to somebody at the county about the funding. In addition, so isn't that great that we're making this available? So know that it's there. Please share the links and make use of that as well. I'd like to, I have confidence that we will be developing out additional visualizations with regard to this information. I think once we get further along, we'll also be able to report out on how the dollars were actually used and also talk with you about ways that we can report out on and share this information in terms of the regional abatement. Any comments or questions about that? Okay, and then the one additional thing that I wanted to, while folks are on, I just wanted to remind or actually inform folks who may not be aware of it, that, and this is particularly for the LGU. So OASAS does have a data page now on our webpage, and we're trying to build out the resources available, to stakeholders and to the community. There's Andrew Heck, and so know that we had put out information in terms of some of the measures, some of the information we typically share with counties. But in addition to that, we're building out other resources. So one thing that we do have here now is our Addiction Data Bulletin. Know that we are going to be issuing this ADB, or Addiction Data Bulletin, periodically throughout the year. It's going to be a resource that's available to folks. We are going to have different topics that we cover through the ADB, and hope that folks think to go to our webpage to look for the Addiction Data Bulletin and look at other topics that we're going to be covering. So know that this resource is available. And we also have our New York State Overdose Death Dashboard that was recently issued, I think maybe a week or two ago. Andrew, do you want to share and talk about this, or do you want me to point and click and you can talk about what's here?
Sure, I guess as long as you have it up, I can just go ahead and talk. You know, as Connie said, this is, I think, will be useful both in terms of just general county planning for the local services plan, but also I think as you look to spend the regional abatement dollars to really figure out what the impact of substances are on your communities. You know, obviously this is opioid settlement funding money, but I think you can really see all drug overdoses and really how opioids, especially fentanyl, play into that. So the first screen has up there, you can see the statewide trends, which I think are obviously very interesting. But everyone here may be more interested in some more of the specific counties. So yeah, so if you click on that, so that will show you the straight numbers of overdose deaths, and that by default it shows 2022, and those are provisional numbers, but you could go actually back to 2018 and a filter if you want. Unfortunately, the source we pull it from suppresses anything under 10. So those are the gray counties, but I think for most counties, for the the general level, you can see, and then you can also filter it by the substance. So that's in the type filter, and then you can filter it by also race and ethnicity. The more filters and sort of crosstabs you do, the more likely you are, to have suppressed data. So you might want to filter by just substance or just race and ethnicity, not both. But again, I think that can really probably help in targeting some of these initiatives. And then, so that's the straight numbers. The next tab is the exact same information. It just is rate, and obviously, both rate and numbers are important as you plan, as you make your case in other forums of your need. Again, we hope a lot of this is, we can't always know how data is going to be used, and one of our goals is just to put it out there, and hopefully you on your level can use it, and let us know, either me at the local planning, OASAS planning email address, or through the opioid settlement funding, if there's other data resources you'd like out there. This is sort of our first one, and obviously it's a very important one, but we look to build this out as we move forward.
Andrew, I'm curious about this, as Connie can probably anticipate, because I'm wondering the data source, because I would tell you there's discrepancies, tremendous discrepancies in source data. So for example, our local Department of Health, they report off the death certificate, which doesn't agree with my office or any first responders. So unless there's like double the amount of people dying after they go to the hospital, which we know isn't true, the data is not accurate. So I'm wondering, is it a sensitivity issue? So for example, the death certificate may say they died of fentanyl because they had 0.0001 gram of, or whatever, of fentanyl in their bloodstream, and therefore they died of fentanyl. I'm not sure that the same standard is being applied everywhere.
Yeah, so if you scroll, Connie, if you can scroll down a little bit, it goes into, so it's from CDC Wonder. So that's the nationwide database of death, essentially mortality statistics. So the underlying cause, so this would be sort of a whole presentation, which actually we could do, but for every death, there can only be one underlying cause, but there can be up to, I think, 10 or 20 what's called multiple cause. So for these, the underlying cause has to be one of the drug overdose categories. And then to determine the substance, it can be under the multiple cause. So you would have to, for it to sort of count in this, it would have to be, an overdose would have to be the underlying cause as determined by the death certificate. And then again, to look at it at the substances, it would be under a multiple cause. That's why if you look, if you go back, you see the number, all the different substances don't add up to the total overdose deaths because there could be multiple substances. So yeah, we acknowledge that there's going to be different sources. New York City uses different sources. But this is really a standardized way to measure that because it's measuring the same here in New York as you would measure a county in Ohio, as the CDC does. Obviously, I've been looking at this for almost 10 years now. There are different sources. Some counties, they have the DA will release death numbers. Some counties obviously have a coroner versus a medical examiner. Which we acknowledge, but that creates a lot of noise. So with, the advantage of using the CDC data is really just that standardization. Although, like you said, maybe on a local level you have a different data source, and if you have a different data source on the local level, obviously you're free to use that. But I think one of the issues this is trying to address too is not every county has those resources. And also, again, cut through that noise of sometimes it comes from the DA, sometimes it comes from the health department, et cetera.
No, and I get that. I guess to my point is it is about planning. So when I look at Chemung County on this map, I see 38, and the most I can come up with is 18 using OD map data that I personally put in because I get the actual report from the first responders. So if I'm looking at the 38, I'm going to have a different response than I'm going to have with 20.
And also, the county is county of residence. So maybe that might also account for the discrepancy. So if someone from Chemung, died somewhere else in the state, and they could trace their residence back to Chemung, then that would count in here too.
So
I would tell you it should balance out because we use if anyone overdosed and died in our county, regardless of where they're from, the address where they're from doesn't matter. It's where found. We're counting it in OD map.
Yeah, and I think there are always caveats, right? And I think this is the challenge with data that, what are your parameters? Who are you including? Who are you excluding? And so I think that, the best we can do is using the information we have available, be clear in terms of the parameter and like how we're defining the groups that are in here, how we're defining the counts. So I appreciate what you're saying, Brian, and that's why we need to talk about it, right? So we can understand, and we want to make sure too, when we're talking about this with others and communicating information using data, we're very clear about what it says and what it doesn't say. And two, this is like a first of hopefully many efforts that you're going to see over the next coming months with us trying to make data available. And I think it helps to get the conversation going, right? And I think that this is one of hopefully a number of resources, right, that the county is already using to inform the needs within your given community. So we were excited because we haven't been in a position to make data available for a number of years, and we finally are able to do that. So we're trying to stretch our wings a little bit and get going with that. So I am thankful to Andrew and his team. I'm also thankful to this group for the thoughtful conversations we have about all the work that we share in, talking about 2024 as being the year of data for OASAS. So look forward to more conversations with all of you about the use of data, the validity of our data, how well our data collection systems represent our continuum, and how do we grow and evolve to do more and better with the data that we collect to understand our continuum. So that sounds fun, doesn't it? That's a little precursor for all of you, a little insider info on what I've got coming for everybody. So last comments or questions that folks have? We are at
There's
59.
one in the chat, Andrew. So, Andrew, does that mean if someone who lives in another county but dies in Rockland County isn't counted in the Rockland County number?
That's right.
Right, and I responded to that in the chat. Yeah, so yes, that's what you can do it sort of either way, and there's sort of pros and cons of doing it both. But I think the important thing is just to be consistent with the way it's counted.
Yeah.
But that is something, you know, if there's desire to see it the other way, and that could also be another page that shows it like that way as well.
Yeah. Yeah. Great. Hey, thank you for a really great conversation this afternoon. I very much appreciate it. I'm like loving this Friday because we're having a lot of really great dialogue here at the office and now with you. So I hope you all have a great weekend. Don't forget that we have our next Opioid Settlement Fund Advisory Board meeting happening on Tuesday. Feel free to come in person or utilize the link that's available on our website to view live. And we will be talking to you really soon. Thanks for all the feedback. It's very helpful, everybody. Take care. Bye.